This is the second part of this presentation, osteoporosis. Osteoporosis is a condition in which the bones become so brittle that they fracture easily. We've learned about the risk factors in the first part. We've also learned about the structure of the bone in osteoporosis. Now let's learn a few things regarding the prevention and management of this condition. So just to refresh your memory, the normal bone looks on the inside very dense with this web-like architecture, very densely packed, whereas in osteoporosis the bone becomes lot less dense, I should say, with loose supporting web-like architecture inside, which of course would mean that these bones are more fragile, more brittle, and can break easily. In order to understand the seriousness of this problem called osteoporosis, let me present to you the issues that one can face with osteoporotic fracture. I mentioned earlier that the common fracture sites are the hip, the wrist, and the backbone. If there were to be osteoporosis and as a result a person has a hip fracture, let us say a person slipped and fell in the bathroom and as a result ended up having a hip fracture, that would require hospitalization for sure, and oftentimes surgery will become necessary, and prolonged immobilization for about a month and a half to 2 months at least, which certainly can lead to many other complications, infection, bleeding problems, or clot formation and so on can result from that. So these are the issues that can result from hip fracture. Now wrist fracture, certainly you cannot use the arm for about a month and a half, maybe up to 2 months even. Cast will become necessary for many, and sometimes depending upon the severity of the fracture, surgery may become necessary. And the complications that I mentioned earlier regarding a hip joint are also applicable to wrist fractures. Spine, the typical fractures are compression fractures, meaning the bones do not get displaced, they do not get separated from each other, but the vertebra or the one of the bones in the spine, one or more of the bones in the spine can sort of get crushed from the weight of the rest of the spine, and this can cause a compression fracture, which will lead to severe back pain for many, not responding to any kind of painkillers and so on. Not only that, because of the close proximity to spinal cord, as you know, the spinal cord is passing through the spinal column or the spine. Now these compression fractures can actually press upon the nerves, the spinal cord itself, and that can lead to sometimes paralysis or in some situations nerve compression, pinched nerves causing severe pain in the limbs. So if the fracture involves any of the vertebrae or the bones in the neck, spine, that can be dangerous, as you can imagine, and that requires surgery and prolonged treatment, physiotherapy and so on subsequently. Very briefly, how does one know if one has osteoporosis? Now, we've discussed the risk factors in the earlier presentation. It's very important that you go over them, and any one of those that you can fix it immediately. But if you do have one or more of these risk factors, you talk to your physician about the possibility of osteoporosis and find out if there is any need for getting tested. Now, X-rays unfortunately do not give us all the information regarding osteoporosis. We do get some basic information, especially regarding the bone structure and certainly about any fractures. But in order for us to be able to diagnose osteoporosis, there is a specific test called DEXA scan, also known as bone density test. It's a painless test. It's an X-ray type test, and it gives us information regarding the density of the bones in different parts of the body. The report can come out as completely normal, or it can be low, slightly low bone density or very low bone density. So if the bone density is slightly or very low, that means that some action is required in terms of preventing the occurrence of fractures. Now, in some situations, depending upon your medical history, certain lab tests will also become necessary for proper diagnosis. This is just to give you a basic idea of what is typically done for diagnosing osteoporosis. If there is one thing that I'd like for you to absolutely take away from this topic, from listening to this, is this, that you can get your bones stronger. It's not that once you have osteoporosis or if you think you have some risk factors, there is nothing you can do about it. There are many things that you can do to get your bones strong. Now, make sure that you eat well-balanced food. Make sure that you eat home-cooked meals, which by far tend to have a higher amount of nutritional value than food that you eat outside. And as part of this well-balanced diet, eat foods that are rich in calcium and vitamin D. We'll talk about them in a minute. It's so very important that you get enough calcium. Of course, calcium is important for bone formation. But why vitamin D? Vitamin D is important because it helps get the calcium from your digestive tract into the bones. So they are both equally important for maintaining bone strength. How do you get enough calcium from your diet? Make sure that you're drinking at least 2 glasses of milk a day. And if you drink coffee, it tends to not give you as much calcium since the amount of milk in coffee is quite low. So you'll want to make sure that you're getting milk in other forms. I recommend skimmed milk or double tone milk because it has no or low fat content. And in addition to drinking milk, you should eat 2 cups of low fat yogurt or curd every day. And this is important so you get enough calcium through your diet. And as part of this balanced meal that we just talked about, eating green leafy vegetables I think is extremely important, and make sure that you eat them at least once a day in different forms. Beans too, by the way, have plenty of calcium, but not as much as milk or curd. And soy cheese is another source of calcium, also known as tofu. And one suggestion that I have for people who love paneer is to use this in its place. Now the taste does differ a little bit, but it has the same consistency, and you can use it as a substitution for paneer. Paneer tends to be high in fat and also cholesterol content. Now, how do you get vitamin D from your diet? It's mainly from milk again, and for fish eaters by eating fish. Certainly not fried fish. Again, you'll lose the benefits because of the excess fat. Now, vitamin D, one important source that you may or may not know about is sunlight. If you are absorbing sunlight, not through glass windows or anything, but directly absorbing sunlight, that tends to convert pre-vitamin D that is located beneath the skin surface into a more active form, and this can be utilized by the body. Now you will need to get enough sunlight for this to happen, and that should be for about at least 20 to 30 minutes every day. Morning sun is better because the intensity is less, and this is applicable for people who have jobs that are indoors and for homemakers or housewives who tend to not spend a lot of time outside. So it sounds kind of surprising actually to hear that in India, where there is abundant sunlight throughout the year, vitamin D deficiency is quite common. And the reason why this happens is because there is not exposure to that direct sunlight in most homes, or of course offices tend to not have any such facility. So that exposure to sunlight is so very important, and if you cultivate the habit of going for a morning walk, you'll get all the sunlight you need and the vitamin D. A few more things about getting your bones stronger. Most important thing to remember as far as activity goes is do not be sedentary. If your job requires that you stay at a desk for 6, 7, 8, 9 hours a day, get up, move around every 30 minutes to 1 hour, and make sure that you do a brisk walk for at least 30 to 45 minutes every single day. And doing some stretching exercises and yoga at home daily would actually help get your bones strong also. If you are a tobacco user in the form of cigarettes or any other form, make sure that you quit. Also quit drinking alcohol, bad for the bones. Now if you're taking any medicines, you'll need to discuss with your physician regarding risk for bone loss. As I mentioned previously, there are certain medicines that tend to cause bone loss a lot faster. So talk to your physician about that and what steps you need to take to prevent this problem. Now, a lot of times women and even men for that matter tend not to get enough calcium and vitamin D through these different sources that we just talked about. So the one important step that you can take is to take supplements that contain both calcium and vitamin D. Now there are many different forms of vitamin D, and the kind that probably would be the best would be vitamin D3, or also known as cholecalciferol. I've included here the names of some not so expensive calcium and vitamin D supplements that provide adequate amounts of both. As you can see on your screen, you may want to get you could get any one of these actually and start taking it on a regular basis if you believe that your calcium intake is not adequate. Now, the recommendations that I made regarding the calcium, vitamin D intake and physical activity and so on, it's basically applicable to all adults of both genders. So let's say you already have osteoporosis. What to do now? The most important thing you need to tell yourself is that you are going to try and make your bones stronger. Like we discussed already, make sure that you're eating those calcium rich foods every day and take supplements. Talk to your doctor if you need to take more than one a day. And walking has to become a part of your daily routine, at least 30 to 45 minutes. Yoga is important for getting those muscles strong so they can hold your bones better, so you won't suffer fractures very easily. If you're a smoker, if you drink alcohol, quit doing both. If you use any other form of tobacco, also quit doing that. Avoid soft drinks. The reason I mention this is because a lot of times soft drinks, drinking on a regular basis, it tends to take away from you the calcium rich liquid sources such as milk. If you're drinking soft drinks, you may not feel or have an appetite for drinking any milk, and therefore your calcium intake goes down even further. Also, soft drinks have been known to hasten bone loss. Mechanism is not clearly known, so try and avoid them as much as possible. Most important thing to remember if you already have osteoporosis is that you will need to absolutely try and avoid falling. Walk carefully, and if need be, use a cane. This is applicable especially for the older adults. And some very common sense but often forgotten tips: make sure that the floors in all the rooms in your house are kept dry all the time, and this includes the bathroom floor. Don't keep it wet constantly, because even a minor slip and fall accident can cause a major disability such as a hip fracture or any some other kind of a fracture. And try not to do anything in a hurry. Take your time and do things in a leisurely fashion. And when you are walking on any kind of a slippery surface, and make sure that you are extremely careful and use proper footwear always. And this is very important that you get your vision checked every 1 to 2 years, just to make sure that there aren't any problems there. Now, if your physician has already recommended specific medicines for treating osteoporosis, take them as advised. And you have to follow the instructions carefully when you're taking medicines for osteoporosis. And make sure that you discuss the effects and important side effects, anything that you need to know about, because some of these medications do have certain very bothersome side effects, and it's your doctor's responsibility to give you that information. So talk to him or her about them. And this is the last slide, and I'd like to for you to remember the following for sure. Remember that osteoporosis is never considered a normal phenomenon. It is not a normal part of aging. It is a medical condition such as diabetes or high blood pressure or stroke or heart attack or any such problem. And if you have sustained a fracture, any fracture as an adult, you may have osteoporosis. This is something that you will need to talk to your doctor about. Now, osteoporosis tends to be a silent disease, meaning that you will not have any symptoms from it until you have a fracture at some point in your life. Indian women especially tend to have a very high likelihood of developing this condition. And the most important thing that you can do from your side in order to prevent or slow down this process is by taking enough calcium in your diet. Milk and dairy products, like I mentioned, are extremely important, so you make sure that you take them regularly. Daily physical activity is an absolute must for everyone for many different reasons, and one of the important ones as far as this issue is concerned is to get your bones strong. You have to stay active and exercise or walk at least for 30 to 45 minutes every single day. Exposure to early morning sunlight, we talked about that already. It's important for getting that vitamin D into your system, so make sure that that happens every day. And absolutely, if you need to take a calcium plus vitamin D supplement, I mentioned a few not very expensive brand names in one of the earlier slides, so try any one of these brands, one a day, and more if your doctor recommends for you to do so. So if you have risk factors that we discussed already in the first part, and you do not drink enough milk or eat curd daily, you more than likely will need calcium with vitamin D supplement. So this is it, viewers, for this topic, osteoporosis. We'll meet again for another presentation. Thanks for listening.